Their homes are what? Continuously. That's why I have been taking the holidays. So, yes, no? Yes, no? That's right. I know, basically, I'm just telling you. So let us just revise the posterior abdominal wall and we will discuss the lumbar plexus. Okay. So what are the things which are present in the posterior abdominal wall? What are the muscles? We have seen already. Psoas major, quadratus lumborum, iliacus. Would you remember all the actions and the direction of the alternate insertion and everything or not? Yes. Right? So psoas major, what is the action during erect posture? That means whenever you are standing, what it does to the hip joint? Flexion. No? During standing posture. Whenever you are standing, exactly, medial rotation. So whenever you are lifting up the lower limb, what will happen? Lateral rotation. Okay. Did you understand the mechanism how it will laterally rotate? Yes. Understood or not? Understood or not? No, right? Right. Fine. And quadratus lumborum we have discussed already. Lateral flexion on either sides. Is it not? Extension of the trunk. Absolutely. Very good. And then what else? Iliacus. What is the function of the iliacus? The same thing. Just like absolutely. Flexion of the hip joint. Absolutely. Yeah. Okay. Right. So what are the vessels we have seen already? Abdominal aorta. What are the branches of the abdominal aorta? What are the ventral branches first of all? Cerebral, superior mesenteric artery and inferior mesenteric artery. These are the ventral branches of the abdominal aorta. Okay. And what are the terminal branches? Common iliac artery. Right common iliac artery and left common iliac artery. What are the lateral branches? What are it? All the way from above downwards, first of all, inferior phrenic arteries, and then followed by, at the level of the superior mesenteric artery, there will be middle suprarenal arteries. Middle suprarenal arteries. Okay, remember this hallmark of it. Okay. So first of all, the immediate lateral branches of the abdominal aorta are first of all the inferior phrenic arteries. So obviously they will be supplying the diaphragm from the under aspect. Is it not? Inferior phrenic arteries. And then followed by this is superior mesenteric artery over here. So at this level on either side there will be two lateral branches. These are the middle suprarenal artery, right side and left side. There are two other branches. One is nothing but the exactly superior suprarenal artery. Remember this properly. Superior suprarenal artery is a branch from inferior phrenic artery on either sides. Okay. For example, there is a suprarenal gland over here. Over the kidney, it is supplied to three branches. One is superior suprarenal artery, one is the middle suprarenal artery, and one is inferior suprarenal artery. Superior suprarenal artery is a branch of inferior phrenic artery, and middle suprarenal artery is a branch of straight away from the aorta. Okay. And then further downwards will be renal arteries over here. Okay, this is the renal artery. This renal artery will be giving rise to inferior. This renal artery will be giving rise to inferior suprarenal artery. Okay, superior suprarenal is from inferior phrenic artery. Inferior suprarenal is from renal artery over here. Okay, above one artery, below one artery, both will be giving branches. And in the middle, there will be the middle suprarenal artery, which is a direct branch from the abdominal aorta. These branches are very much important, which will be asked in the examination. Okay. Further downwards, there will be gonadal artery, absolutely. Either ovarian artery or testicular artery. Okay. Gonadal arteries. Okay. So obviously, by these you can understand suprarenal artery. Obviously, they will be supplying the suprarenal glands. Okay. And then renal artery, they will be supplying the kidneys, obviously. Okay. And then gonad, they will supply the testis or ovaries over here. Okay. So these are the lateral branches over here. Okay. Right. What are the dorsal branches? Right? Dorsal branches? Median sacral artery will be arising from posterior aspect, obviously the dorsal artery. So that will be arising downwards in this manner and lies in front of the sacrum over here. Is it not? Here it will be L4 Here will be L5. From here onwards it will be sacrum. Is it not? The bifurcation of the abdominal aorta occurs at the level of L4. Not bifurcation. The formative veins of inferior vena cava at the level of L5. Nothing but the right and left common iliac veins. Is it not? Right. So median sacral arch will be going downwards in this manner. So it will be lying in front of the sacrum and it will reach the coccyx also. Okay, and it will be supplying the what structure which is present over here in front of the sacrum? Rectum, absolutely. The rectum is supplied by the median sacral artery, and it will be forming anastomosis with lateral sacral arteries, which are the branches of in area? Lateral sacral arteries. What are the these are the branches of posterior division of internal iliac artery. We'll discuss a little bit. Okay. So first of all, the median sacral artery will supply the rectum over here and also forms anastomosis with the lateral sacral arteries over here. Okay. And then other dorsal branches are at each and every vertebra there will be lumbar arteries. There are 4 pairs of lumbar arteries. Okay. This dotted line indicates posterior aspect. Okay, dorsal aspect. On the dorsal aspect there will be medial sacral artery which goes downwards over here. And then 4 pairs of lumbar arteries at each and every vertebra. For example, there is a vertebra over here. These lumbar arteries are the 3rd lumbar arteries because there will be L3 vertebra over here. Could you understand? And then here will be L2 and L1. Okay, and further. Okay. So these are the 4 pairs of lumbar arteries which are the dorsal arteries over here. Okay. So here you are supposed to remember a few things over here. So a patient, whatever the age might be, for example 23 years of age, male or female, whatever it might be, met with a road traffic accident, okay, or he or she hit the steering wheel by hitting a lorry. Could you pronounce the steering wheel, the car or something, whatever, okay? The steering wheel hit in the abdomen to her or to him, okay? So followed by her pulse rate gradually increased. Not gradually, rapidly increased. Pulse rate gradually increased and blood pressure gradually reduced over here. Okay. So the patient is brought to the casualty with the signs of sweating and palpitation. Palpitations means increased heartbeat. That means that you can hear the heartbeat. You can feel the heartbeat. Is it not? In tension. During tension, you will be hearing your heartbeat, right? So those are called the palpitations. Okay. And slowly, whenever he or she approaches the casualty, the patient has been complaining of reeling sensation. Okay, remember this. First of all, the patient has been brought to the casualty with sweating. Okay, and palpitations are present over here. Gradually, the patient has been losing the consciousness. Okay, what do you think with respect to the abdominal aorta? Following road traffic accident, what would have happened to the patient? Just imagine, right? Understood the question or not? Understood the case or not? A patient is brought to the casualty, met with an accident. Okay, that means the steering wheel hit in the abdominal wall over here, anterior abdomen over here, following a hit to the lorry, accident. The car hit the lorry. Okay, and he or she is brought to the casualty with excessive sweating over here, and then palpitations are occurring over here. So palpitations is representing increased heartbeat, increased heart rate indicates. Increased heart rate indicates. Which activity? No, it's okay, but it's sympathetic activity. Sweating also sympathetic activity. So sympathetic activity has been activated over here. Okay, and then followed by whatever he said, because the bleeding occurs within the body, so there will be lack of blood supply to the organs. So heart is trying to pump the blood as much as possible, whatever the little amount of blood for each and every cardiac output. Okay, so palpitation, excessive cardiac output, not excessive cardiac output. For each and every systole, there will be little amount of blood will be ejected out. Okay, for each and every systole, but little amount of blood. Normally, if this much amount of blood is ejected outside, but now because of the lack of blood, this much of amount of blood will be ejected outside. Okay, so small amount of blood, multiple amounts. So that will be distributed to the whole body. Okay, so what would happen happened over here? There is an injury to the abdominal aorta over here. For example, there is an injury over here. How the injury has been happened over here? For example, there will be lumbar vertebra. Behind these will be the lumbar vertebra, which are the strongest things among the entire abdominal organs and everything. Is it not? So whenever that patient was hit by the steering wheel over here, the abdominal aorta will be hitting the lumbar vertebra in this manner. So the lumbar vertebra got crushed in between the steering wheel and the lumbar vertebra. Could you understand? Could you understand or not? Okay. So at this time, the vessel will be having how many layers? Tunica, intima, media, and adventitia or externa, whatever. Okay. First of all, these two layers will be injured over here. Okay. These two layers will be cut whenever there is a hit occurs in between the steering wheel and the lumbar vertebra. So the inner layers will be cut first of all. And then later on, because of the blood pressure applied to the walls of the abdomen, walls of the abdominal aorta, this last layer also will be punctured over here. Could you understand? So that's why the patient is gradually losing the consciousness over here. Okay. Initially this wall is injured over here, internal wall is injured over here, and later on due to the blood pressure, this outer wall is also got injured. Okay. So there is a crack occurred in the outer wall also. So slowly the blood is leaking outside into the abdominal cavity or peritoneal cavity, whatever it might be. Okay. So the blood, the bleeding occurring into the peritoneal cavity. So the blood supply to the other organs is getting reduced over here. So that's why palpitations, heart rate has been increased over here. Getting it on? So this is nothing but the internal bleeding which is occurring following a road traffic accident. Getting it on? So whenever you found a patient gradually losing consciousness, you are supposed to think of internal bleeding because of the injury to the abdominal aorta. Understood or not, everybody? Right. So there are other reasons for the internal bleeding. There is a dilatation in the wall of the abdominal aorta. What is this termed as? What is that? Aneurysm. Okay. Aneurysm means because of the weakness of the wall of the aorta, anywhere in the entire body, if the arteries wall is becoming weakened over here, that inflates like a balloon over here in this manner because of the weakness. Could you understand? Right? Here this wall is thick, so it will not be dilated over here. But here the wall become thin over here because of the blood pressure. The wall become ballooned over here. Getting it out? And the blood will be accumulated in this entire aneurysm over here. If there is further increase in the blood pressure, this wall, because it is thin wall, it will break over here. Again, the internal bleeding will occur over here, and the patient will die. So this is a sudden death, and this is a gradual death. If all the walls of the blood vessel is getting cut over here before following the injury, again the sudden death will occur. Get it out? If only internal two layers are broken over here initially, the death will be slow. But all the walls layers got broken over here, the death will be immediate. Here, whenever the break occurs within this aneurysm, the blood will be immediately leaked into the abdominal cavity or peritoneal cavity, and the patient will immediately die of lack of blood supply to all the organs over here. Got it or not, everybody? So this is the aneurysm, and this is a road traffic accident over here, or any fall from height or whatever. Different scenarios will be there. Getting it on? So the thing is mainly the artery aorta will be crushed in between the solid structure in front and behind lumbar vertebrae. But here there will be weakness which is occurring because of atherosclerosis. What is atherosclerosis? Atherosclerosis means what does it mean? Deposition of cholesterol or fat within the wall, over the wall of the aorta over here. So whenever it is accumulating over here, this wall, it will become weakened over here. Getting it over? So there will be fibrosis occurs over here, and this wall will become weakened over here. Slowly it will get weakened because of the atherosclerosis. Okay. Sclerosis means fibrous tissue formation. Absolutely. Okay. So the fat will be accumulated, or cholesterol will be accumulated over here. Later it undergoes fibrosis over here. Okay. Fibrosis is nothing but the inflammatory reaction. Is it or not? Fibrosis occurs because of the inflammatory reaction. If you get any wound over here, slowly it will undergo fibrosis. So it's then part of inflammation over here. Okay. So this part of the wall will become inflamed over here. So obviously there will be weakness of the wall of the aorta. So this dilatation will occur because of the weakness of the wall over here. Understood or not, everybody? Understood, right? So these are the different scenarios. So any other scenario which will be, for example, if there is a internal bleeding over here, the lower limbs will not be getting the blood supply over here. Is it or not? Any other scenario we can expect? For example, if you take over here, whenever this is a wider lumen of the aorta over here, whenever it is giving the branches, it is becoming narrower. Is it not? Initially it is this much wider, but whenever it is getting branching over here, it is becoming narrower over here. So if any blood clot occurs over here, either over here or over here, because of the embolus all the way from the heart. Okay, if there is any embolism which is occurring in the heart, it is traveling through the abdominal aorta and blocking the abdominal aorta at this level. That means where the common iliac arteries are branching over here at this level, or individually in each and every internal iliac artery over here. So what happens to the patient over here? What happens to the patient? Exactly, the lower limbs will become ischemic. So followed by gradual necrosis will occur. Getting it up? So for this, what we are supposed to do? We have to remove this part of the aorta and we have to bypass it. What is bypass? You are joining this thing with this thing over here through another channel. That is called the bypass. Okay. So whenever this clot is occurring over here, you can remove this because this clot is creating inflammation over here. The fibrosis will occur. So you can't clear this off completely. Getting it on? So you have to remove this part and you have to make a bypass over here. Getting it on? So this is the clot. But in case of atherosclerosis, what will happen? For example, if the patient has been smoking. Smoking leads to what will happen? Smoking, what will happen? What it does?
Oh, so vasodilatation.
Okay, vasodilatation or vasoconstriction, but basically what it does normally? Smoking, what it does? Anybody smoking here? Huh? No? No? It's okay, fine. Okay. The smoking carbon particles will be entering into the bloodstream, is it or not? Is it or not, right? So that will be slowly giving rise to atherosclerosis again. Getting it on? The smokers, or normally in case of elderly people, atherosclerosis will occur. Okay. Smokers will be gradually, the blood vessel will become narrowed. Okay. Gradually will become narrow. Okay. You'll be understanding that later. But there is any atherosclerosis over here. The plaque will be gradually enclosing the entire lumen over here. Gradually. Is it not? During atherosclerosis, slowly the fat will get deposited over here. Slowly. And later on it will be completely closing the vessel over here. Get it out? For example, the atherosclerotic plaque which is occurring towards the one left common iliac artery over here. So initially it has blocked till this part over here. So what will happen to the patient? Whenever the patient has been walking over here, this part will be getting this lower limb, because whenever we are walking, the metabolism will increase. We need more blood for the lower limbs. Is it not? Is it not, right? So obviously we need more blood supply to the lower limbs. But because of this obstruction, what will happen? There will be less blood supply to the lower limb. For example, this is the left lower limb over here. Left lower limb. So this is getting less blood supply over here. So what will happen to the patient? For example, patient is walking over here. So what happens to the left leg of the patient? He is walking. The patient has been walking. Okay, very fast, very quickly he is walking. But this side, there is no obstruction over here. The blood supply to the lower limbs is good. Okay, so there will not be any problem with the right lower limb. But what happens to the left lower limb? Fatigued, absolutely. So what will happen? The blood supply to this left lower limb has been reduced, so that undergoes fatigue. So that leads to gradually leading to ischemia of that lower limb. So what will happen? The patient will walk for some distance. He will feel pain in the left lower limb. He stops for some time, for 5 or 10 minutes. Again, this will be dilated over here slowly, because during vasoconstriction, the blood supply will increase. So there is a vasoconstriction during walking, but whenever the patient has been resting, this will be dilated again normally for taking rest. So again, the blood supply to the left lower limb will be increased. So again, the fatigue will be lost over here, and then again patient will start walking again. And again, after some distance, he will be sitting because of the ischemia over here, and again the blood supply will become normalized, and again the patient will walk. So movement and stoppage, and movement and stoppage. This is called claudication. This can be seen in smokers also. Okay, because of the release of substance P. Okay, you'll be understand that later. Okay, not now. So claudication means the patient will be walking to some distance because of the fatiguability and ischemia to the lower limb, because of the vasoconstriction and everything, because of the atherosclerotic plaque over here. The patient will stop over there because of the pain in the left lower limb, and then again, after some time, after regaining the blood circulation, again the patient will walk to some distance, and again he will get the pain because of the vasoconstriction and the obstruction over here, and again he stops, and again he starts walking again. So walking, stoppage, walking, stoppage. This thing is nothing but claudication. Okay, claudication is this thing. Okay, so this thing occurs because of the atherosclerosis or because of smoking also. Okay, getting it down, everybody? Right. What is it? What is it? What is it? Coming to the inferior vena cava also, the tributaries will be similar to these veins. There will be renal veins, gonadal veins over here, and then what else? Suprarenal veins and all these things. But one thing you are supposed to remember, the gonadal vein of the right side will be draining straight away into the inferior vena cava. What is it? Gonadal vein. These things are important. This branches and tributaries will be discussed in the lecture class. Okay, I will be just mentioning. Later how they supply, what they supply, and everything will be discussed in the lecture class. Okay. So, but few things you are supposed to remember. The right gonadal vein will be draining straight away into the, what is it? Inferior vena cava over here. But the left gonadal vein will be draining into left renal vein. This is very much important. Left gonadal vein will be draining into left renal vein. Okay. This you are supposed to understand. Okay. Because of this arrangement, there occurs a condition called varicocele in case of males. What is varicocele? Varicocele. Varicocele. Okay. Gonadal vein means what you can understand. It belongs to testis in case of males. Is it or not? Right. The right gonadal vein is straight away draining into the inferior vena cava straight away. But the left gonadal vein will be draining into left renal vein over here. Okay. Because of this perpendicular tributary over here, there will be a little bit of obstruction in some individuals to this gonadal vein over here. So what will happen? So in case of testis, for example, there is a testis over here. Testis will be having spermatic cord. Spermatic cord will be carrying plexus of veins which ultimately form this gonadal vein. Getting it out? So the testis will be draining into plexus of veins over here within the spermatic cord, that eventually forming the gonadal vein over here. Okay. So when hello. Hello. Good afternoon, everyone. Okay. Yeah. Hello. Okay. No. I don't hear. Yeah, I don't hear. Okay. So because of this perpendicular drainage of the veins which are related to the testis over here, there will be some individuals there will be obstruction over here due to increased abdominal pressure, or sometimes the superior mesenteric artery will be going over here. Some reasons there will be obstruction at this level. Okay. So because of this obstruction, there will be pooling of blood within these plexus of veins. Getting it out? So now these plexus of veins are within the scrotum over here in this manner. Okay. So these veins will be dilated because of the pooling of the blood. So increased temperature will occur because of the dilatation of the veins. Isn't it or not? Whenever there is an obstruction of the veins over here, so there will be pooling of the blood over here. So temperature normally towards the testis it will be a bit less compared to the normal body temperature. But whenever there is a pooling of blood is occurring over here, the temperature will rise over here. So that leads to infertility in case of male patients. Nothing will happen to the female patients over here. Getting it or not? So because of these dilated veins which are present over here, that will be creating more temperature for the left-sided testis over here. That is leading to infertility. Okay, the sperm count will reduce over here. Okay, this is the complexity which occurs because of this perpendicular drainage of the gonadal vein into the left renal vein over here. Getting it or not? Right? But the right renal, so this varicocele occurs generally in case of left-sided, but there is a chance of right-sided varicocele also, but it is very rare. Getting it or not? Varicocele means dilated veins over here. That is leading to the increased temperature. That is leading to the infertility. That is nothing but the varicocele over here. Getting it out? Varico means varices. You know, varices means dilated veins over here. Okay, seal means like a bag. Okay, the scrotum acts like a bag over here, bag of worms over here. Varicocele is also termed as bag of worms. The worms are nothing but the dilated veins over here, and the bag is nothing but the scrotum over here. As a whole, it is varicocele. Seal means like a bag. Okay, varico means veins, dilated veins are called the varico. Okay, have you ever heard varicose veins? Yes. So that is what. Okay, varicose veins. Okay. So you are supposed to remember the left gonadal vein will be draining into the left renal vein over here, and also the left suprarenal vein will be draining into the left renal vein over here. Try to remember this. Left renal vein will be getting two tributaries. One is the gonadal vein particularly, and one is the left suprarenal vein over here. Getting it out, right? Again, the right suprarenal vein will be directly draining into the inferior vena cava over here. Got it out, everybody? Okay. And then right renal vein will be as usual. Right renal vein will be as usual. And then the uppermost veins will be phrenic veins, inferior phrenic veins. So these are the tributaries, inferior phrenic veins, then followed by the suprarenal vein, then followed by the renal vein, then followed by the gonadal veins over here. And eventually there will be, what are these? Common iliac veins. These are the common iliac veins, which are the formative veins of the inferior vena cava. Okay, this will be discussed again in the lecture class. Okay. So what are the branches of the common iliac arteries? Anybody? Branches of the common iliac arteries? First of all, external iliac artery and internal iliac artery. External iliac artery branches? What are external iliac artery branches? External iliac artery. External iliac artery branches? Inferior epigastric artery. Okay. Few other branches we already know that. From the femoral artery. Whenever the external iliac artery is converted to femoral artery, few other branches will come. What are those? We have seen already during inguinal canal. Superficial, superficial, epigastric, and superficial external pudendal and superficial circumflex iliac arteries. Okay, these are the basic branches. Okay, and external iliac artery will be becoming femoral artery. Femoral artery eventually will become popliteal artery. Okay, we will be discussing that later. But the branches of the internal iliac artery are very much important. What are the branches of internal iliac artery? For example, first of all, this is the abdominal aorta, this is the common iliac, and then followed by external, what is this? External iliac artery and internal iliac artery. Okay. This is the external iliac artery, and this is the internal iliac artery over here. External iliac artery will be continued as femoral artery. Femoral artery. Okay. So just remember this. Abdominal aorta divides into two common iliac arteries over here, and each common iliac artery will be divided into external and internal iliac arteries over here. External iliac artery, apart from inferior epigastric and everything, it will be finely straight if it goes downwards into the lower limb and will become the femoral artery. The external artery converts into the femoral artery, just like the axillary artery becoming the brachial artery over here. Okay, external artery will become the femoral artery. Just remember. Okay, but internal iliac artery is divided into two divisions. One is anterior division, one is posterior division over here. Anterior division and posterior division. Okay. First of all, let us see the posterior division branches. Okay. First of all, abdominal aorta, two common iliac arteries, right and left. Each common iliac artery divides into internal and external iliac arteries. External iliac artery becomes straight away the femoral artery, which is the artery of the lower limb. But internal iliac artery supplies all the viscera within the pelvic cavity. Remember this. Okay. External iliac artery, femoral artery, nothing but the limb artery over here. But the internal iliac artery will be supplying all the pelvic viscera. Okay. So how they will supply? First of all, we'll see the internal iliac artery divisions. Okay. Internal iliac artery divides into anterior division and posterior division over here. So the posterior division branches are, we have already seen iliolumbar artery. Is it or not? We have seen it in triangle of Marcelli. Is it or not? Iliolumbar artery. Have you seen a triangle of Marcelli or not? Right? And then followed by laterosacral artery, with which the median sacral artery will be anastomosing over here. And then one more is the superior gluteal artery. You know very well. Superior gluteal artery. Above which muscle? In the greater sciatic notch, above which muscle the superior gluteal artery will be supplying the gluteal muscles? Piriformis, exactly. Piriformis. Okay, very good. So superior gluteal artery and lateral sacral artery and iliolumbar artery. If you see over here, everything belongs to the posterior aspect of the abdomen. Is it or not? Iliolumbar artery we have seen at the level of the ale of the sacrum, going upwards, right? And the lateral sacral artery, obviously, it will be anastomosing with the median sacral artery, which is also again on the posterior aspect, which is lying in front of the sacrum over here. And one is superior gluteal artery, again towards the back aspect, nothing but the gluteal region. Okay, so three branches towards the posterior region. Getting it on it? Getting it on it, right? So three branches, one belongs to the gluteal region, one belongs to the lumbar region, then the head of the sacrum, and belongs to the lateral sacral artery over here. Towards the sacrum, two things, and superior gluteal artery over here. Got it on it, right? So rest of the viscera will be supplied by the anterior division over here. So what are the viscera we can get within the pelvic cavity? We have already seen. What are those? All the way from anterior to posterior direction, what are the viscera we can get? First of all, the branches are the anterior division branches over here. First of all, obliterated umbilical artery. We have seen, is it or not? The median umbilical fold, medial umbilical folds. The medial umbilical folds of the peritoneum contains this obliterated umbilical artery. Is it or not? Right? So if you go a little bit laterally, there is an obturator canal. Is it or not? What is it? Obturator canal is present. So obturator canal, what artery will be passing over there? Obturator artery. Is it or not? Obturator artery. Okay. And then leave about the obturator canal. So if you go from anterior to posterior direction, what are the viscera? So immediately behind the pubis, which viscera is present? Which organ is present? Bladder. So there will be superior vesicular artery and inferior vesicular artery. You can say that. Vesicle, you can say. Superior vesicular artery, inferior vesicular artery. So urinary bladder will be supplied by superior vesicle. Vesicle means urinary bladder. Superior vesicular artery and inferior vesicular artery. Okay. And then further back, in case of female, there will be ovary and uterus and vagina. Okay. So uterine artery and vaginal artery. Okay. Uterine artery and vaginal artery over here. Okay. And then further downwards, further backwards will be rectum. There will be which branches will be coming from rectum over here? No, middle rectal artery. Middle rectal artery. Okay, but inferior rectal artery actually from internal iliac artery, anterior division. A branch will be coming over here, pudendal branch over here. That will be giving rise to inferior rectal artery. We'll be seeing that later. Okay, so middle rectal artery. Getting it on it, right? So these are the branches. Whatever the viscera which is present in the pelvic cavity will be supplied by all these branches, which are the branches of anterior division of the internal iliac artery. Could you understand? Posterior division, only these three branches over here. Rest of the branches are from anterior division over here. So if you remember the viscera in a sequence all the way from anterior to posterior direction, you can write all these branches over here. Getting it out, right? So one more branch is nothing but the pudendal branch. Pudendal, I told you already. Pudendal means, remember which region? Genital region and plus perineum also. So what are the things which are present in the genital region? What are the things which are present in genital region, right? Right, genital region, what are the things which are present, right? Genital region in case of males contains come on. Dorsal penile artery and deep penile artery. In case of females, it will be, what is the representation of female? Clitoris, absolutely. Okay. So dorsal artery of penis or dorsal artery of clitoris, and deep artery of penis or deep artery of clitoris. Okay, and then followed by urethra. urethra will be coming through the genital region, is it or not? Through the penis only the urethra will come out, right? And then followed by inferior rectal artery. Okay, could you understand? And one more branch is perineal. Perineal branch. Okay, these are the branches all the way coming from pudendal branch. Getting it or not? Pudendal branch will be giving rise to all these branches over here. So let us revise. So abdominal artery divides into two common iliac arteries, right and left common iliac arteries. So each common iliac artery again divides into external and internal iliac arteries. External iliac artery will be becoming femoral artery. Internal iliac artery again divides into anterior and posterior divisions. Posterior division artery gives rise to superior gluteal artery, and one followed by lateral sacral artery, and one followed by iliolumbar artery. So obviously here will be inferior gluteal artery also. Inferior gluteal. Okay, inferior gluteal artery is also branch of. Let us see. Okay. So lateral sacral arteries and iliolumbar artery. These are the branches of the posterior division, and rest of the branches are from the anterior division, which will be supplying basic pelvic viscera over here. Getting it on it? So these branches are nothing but the first of all anterior to lateral aspect, obliterated umbilical artery, then followed by the obturator artery. From anterior to posterior direction, what are the viscera? First of all, bladder, superior vesical artery and inferior vesical artery, and then followed by the uterine artery and vaginal artery over here, and then followed by middle rectal artery, and then followed by the inferior gluteal artery over here. Okay, so based on the organs you can remember these things over here. Okay, and one more branch of the anterior division is nothing but the pudendal branch. That pudendal branch will be giving rise to all the genital and perineal branches over here. Getting it or not? So pudendum means remember genital and perineal region. I have told you where the perineum is present. Is it or not? Perineum is where it is present. Simply to remember, in between the two thighs, the lower aspect of the pelvis is nothing but the perineum. In between the two thighs, the lower aspect, wherever the genital region in front and anal region behind will be present, that entire region is called the perineum. Could you remember or not? Right? Right. So those perineum, the perineum is supplied by these perineal branches of the pudendal artery over here. Pudendum means again genital region, so dorsal artery of the penis, deep artery of the penis, or clitoris, and then followed by the urethral, and then followed by the inferior rectal arteries. These are the branches of the pudendal branch of the anterior division of the internal iliac artery. Understood or not? Right? Right. So everybody read the lumbar plexus? No? Yes, sir? No. It's okay. What are the nerves we have seen in the last class? Those are lumbar plexus. So somebody tell me, right, who have read branches over here? Then followed by let us try to understand the lumbar plexus over here. Okay. Lumbar plexus all the way starts from L1 to L3. Okay. And sometimes L4 also. Sometimes. Okay. Generally it will be including L1, L2 and L3 nerves over here. Which nerves? Spinal nerves over here. Which rami? Ventral rami, not the dorsal ramus. Okay. Don't consider the dorsal ramus in your MBBS curriculum. Okay. Never utter any dorsal ramus in your entire MBBS. Okay. So that you can remember. Dorsal ramus will be supplying the posterior aspect, like back. Back muscles and everything you don't have in your syllabus. Okay. So whenever anybody asks about any ramus, for example, you take the brachial plexus, everything belongs to ventral rami. Sacral plexus, ventral rami again. Sorry, lumbar plexus, ventral rami again. So don't utter a word called the dorsal ramus. Dorsal ramus belongs to back. Okay. What? Absolutely. Back muscles you don't have in your syllabus. Okay. So whenever you utter any plexus, just utter only ventral ramus. Okay, ventral ramus. Ventral ramus means, you know how the ventral ramus comes out? You know, from the spinal cord? Could you remember or not? You don't know? From, for example, this is the, this is the spinal cord, for example. So ventral ramus, ventral root, ventral root and dorsal root. Wherever they join together, that will form a spinal nerve. That again divides into dorsal ramus and ventral ramus. Got it? So this is spinal cord, ventral root and dorsal root. Both will join together and form the spinal nerve. Spinal nerve is a mixed nerve, and that again divides into ventral ramus and dorsal ramus. So this part we are concerned with now. Anyway, getting it out? So what are the things? First of all, L1, L2, L3 and these L1, L2, L3 will be forming the lumbar plexus alone. But whenever L4 nerve will be joining with the L5 nerve, that will be forming what? Lumbosacral plexus. What is it? Lumbosacral plexus. This will be further joining with the sacral nerves over here and will be forming the lumbosacral plexus. So by this you can understand the lumbar plexus are joining with the sacral plexus over here through these two nerves over here. Getting it out? So whenever, because of this L4 nerve acting as a connecting link between sacral plexus and lumbar plexus over here. Is it not? Okay. So that's why L4 nerve is called. What is that? Sorry. The L4 nerve is called futis nerve. What is it? Futis nerve. Okay, because it is acting as a connecting link between the lumbar plexus and sacral plexus. This L4 nerve is called nerve futis nerve. What is it? Futis. Futis nerve. Okay. Fuctus nerve, nerve of Fuctus over here. Okay, so this L4 nerve is termed as Fuctus nerve because it is connecting the lumbar plexus with the sacral plexus. Remember this. Okay, lumbar plexus is not everything is lumbar plexus over here. Till L1, L2 and L3 will be forming the lumbar plexus, and you can see the branches all the way arising from these three nerves only. Could you see that? Right? Okay. And then L4 nerve will be joining with the fifth nerve over here and will be forming the sacral plexus, lumbosacral plexus over here. Getting it out? So these are also called the prefixed and postfixed type. If it is, this Fuctus is acting from L3 nerve, it is called the prefixed type, just like the brachial plexus, prefixed type. And if it is from L5 nerve, it is called the postfixed type. Getting it out? This nerve of Fuctus will be from L4 over here, connecting link between lumbar plexus and sacral plexus. If the same nerve is occurring from the L3, it is called the prefixed type, or if it is occurring from L5, it is called the postfixed type. Okay, so this is called the nerve of Fuctus or Fuctus nerve over here. Okay, let us see the lumbar plexus over here. First of all, the L1 gives rise to two branches, upper branch and lower branch over here. Okay, upper branch is a bigger branch and lower branch is a smaller branch. First of all, we are taking L1, that is giving rise to one upper branch and one lower branch over here. This upper branch joins with the T12 nerve over here, T12 nerve over here, and will be forming a branch over here. And will be forming a branch. That again divides into two branches. Two branches joined over here, and again divides into two branches over here. One is nothing but the iliohypogastric nerve, and then followed by the ilioinguinal nerve. Will you remember or not? Right? Okay. So this is a twig from the T12 nerve, not the actual T12 nerve. It's a twig from the twig means what? Right? A small branch is called the twig. Twig, T-W-I-G, twig. Twig of any nerve is a small branch. Okay. This T12 nerve gives rise to a small twig over here that will be joining with the upper branch of the L1 nerve and forms a single trunk over here. That will again divide into two branches over here. One is the iliohypogastric nerve above and one is the ilioinguinal nerve below. Okay. So what happens? What is happening with the T12 actual T12 nerve? It will be forming a subcostal nerve. Is it or not? T12 nerve is nothing but a subcostal nerve. That subcostal nerve will be giving rise to a small branch over here. That will be forming these two branches over here. Okay. Then coming to the lower branch of the L1. So far we have seen the upper branch of the L1, now lower branch of the L1. Okay, again L2 branch over here. L2 is again dividing into upper branch and lower branch over here. So this lower branch of the L1, just like the T12, and upper branch of the L2, both will join together and form a nerve over here that is nothing but the genitofemoral nerve. Genitofemoral nerve over here. Just remember these things, okay? Genitofemoral, okay? And then the main trunks over here, L2, L3 and L4 are again divided into dorsal and ventral branches over here. So you are taking L2, L3 and L4. If you divide into this purplish one is called the dorsal branch and green colors are called the ventral branch over here. Okay. So each and every nerve is dividing into dorsal and ventral branches over here. Okay. So if you join L2, L3 and L4. So L2, L3 and L4 dorsal branches, then that will be forming the femoral nerve, which is a thick nerve. Have you seen or not? Femoral nerve, I have shown you, no? Lateral to the psoas major is the femoral nerve, which is a thick nerve. So dorsal branches, because if you take that, obturator nerve is towards the ventral aspect and femoral nerve is towards the dorsal aspect. Lateral it is going. Is it or not? Could you able to remember or not? Right? So the femoral nerve is formed from dorsal branches of L2, L3 and L4. Okay. So this is forms the femoral nerve over here. And ventral branches of L2, the green color ones are called the ventral branches over here. The L2, L3 and L4 ventral branches will be forming the obturator nerve over here. Getting it down? Obturator nerve over here. And there is one more nerve called the accessory obturator. Okay, we'll see that. There is a nerve which is associated with the femoral nerve lateral to the psoas major. Is it or not? The psoas major is present over here. The psoas major is present. Lateral to the psoas major we have seen lateral femoral cutaneous nerve of thigh and femoral nerve. Medial to the psoas major we have seen the obturator nerve and of course the accessory obturator nerve. Okay. So lateral femoral cutaneous nerve will be forming from the dorsal branches of L2 and L3 again. Could you understand? Could you understand? For example, L2 and L3 and L4 divides into dorsal and ventral branches in this manner. Okay. These, for example, L2, L3 and L4. So, for example, these are the dorsal branches, these are the ventral branches. So, these dorsal branches will be forming the femoral nerve over here. Getting it down? Femoral nerve. L2 and L3 and L4. These ventral branches are forming obturator nerve. Getting it down? Again, from L2 and L3, same dorsal branches will be giving rise to lateral femoral cutaneous nerve of thigh. Getting it down? Again, the ventral branches of L3 and L4 will be forming the accessory obturator nerve. Could you understand? Could you understand, right? L2 and L3, L4, dorsal branches, L2, L3 and L4, ventral branches. So if you join these three, it will be forming the femoral nerve. For example, psoas major is going over here. These three will be joining together, will be forming the femoral nerve. And the ventral branches will be joining together and forming the obturator nerve over here. If you join these upper two and these lower two, that will be forming the lateral femoral cutaneous nerve of thigh and accessory obturator nerve. As simple as that. So L2 and L3 will be giving rise to lateral femoral cutaneous nerve of thigh, same dorsal branches. And same ventral branches will be giving rise to extra branches which are nothing but the L3 and L4. That will be joining together and form the accessory obturator nerve. As simple as that. Would you understand or not? So L2, L3 and L4 for the femoral nerve and obturator nerve. L2 and L3 for the lateral femoral cutaneous nerve of thigh and accessory obturator nerve L3 and L4. So femoral nerve and lateral femoral cutaneous nerve of thigh are the dorsal branches and obturator nerve and accessory obturator nerve are the ventral branches. Isn't it easy, right? Difficult, huh? Still difficult. Simple, right? L2, L3 and L4, dorsal and ventral branches. Dorsal branches, all of them together will be forming femoral nerve. Only upper two joining together and forming lateral femoral cutaneous nerve of thigh. And coming to the ventral branches, if you join all the three, it will be forming obturator nerve. If you join only the lower two, L3 and L4, accessory obturator nerve. So L2, L3 and L4 got over. So only from L1, how many nerves are coming? Iliohypogastric nerve and ilioinguinal nerve. Whenever the lower branch is joining with the L2, it will be forming the genitofemoral nerve. That's all. Right on? From the L1, iliohypogastric nerve and ilioinguinal nerve. But from L1 and L2, there is genitofemoral nerve. That's all. We got all the lumbar plexus. Understood or not? From L1, what are the branches? Iliohypogastric and ilioinguinal nerve. But from L1 and L2, there will be genitofemoral nerve. We have already known the L2, L3 and L4 nerves over here. So these are nothing but the lumbar plexus. Getting it out? So the root value of genitofemoral nerve will be L1 and L2. Root value of, for example, accessory obturator nerve? L3 and L4. Root value of lateral femoral cutaneous nerve of thigh? L1 and L2. What are the root values of femoral nerve? L1 and L2. Sorry. L2, L3 and L4. But dorsal divisions and obturator nerve, again L2, L3 and L4, ventral divisions. That's all. That is nothing but the lumbar plexus over here. But how these nerves are supplying the structures over here? So we have somatic nerves and sympathetic nerves which will be supplying the abdominal and pelvic viscera. Is it or not? Is it or not?
Lumbar plexus contain the nerves of L1, L2 and L3. All the nerves are not in the lumbar plexus.
Everything is in the lumbar plexus now. L1, L2 and L3, everything is in the lumbar plexus. But only one thing extra is L4, apart from this branch. Because this nerve is acting as connecting link between the sacral and lumbar plexus. So this way it is called the fructis nerve. Apart from this, rest of the things are presenting the lumbar plexus over here. Got it or not? But from here onwards it is termed as the lumbosacral plexus over here. All the way from L4, it is termed as the lumbosacral plexus or lumbosacral trunk. Got it or not? Right?
So which one is exactly the fructis?
This part. This part. Only that. Because this upper part is forming the plexus over here, but this lower branch is joined with the L5, and this L5 further joins with the sacral plexus. So that's why this is called the lumbosacral trunk or lumbosacral plexus. Lumbar and sacral. Got it or not? All the way from L4 lower branch. Okay. So L5 is purely belongs to the lumbosacral plexus, and L4 is partly belongs to the lumbosacral plexus. But the main connecting link is the lower branch of the L4 over here. Getting it or not? Okay. So how these nerves are going, I will tell you simply. Okay, iliohypogastric nerve and ilioinguinal nerve will be passing where they are passing, where you have seen in the cadaver, in front of the quadratus lumbar. Is it not? Subcostal nerve also in front of the quadratus lumbar, right? So subcostal nerve, iliohypogastric nerve and ilioinguinal nerve are lying in front of the quadratus lumbar. But these are emerging out through the lateral border of the psoas major. All these nerves which are formed in the psoas major only. All these lumbar plexus will be formed within the substance of the psoas major, but comes out through the lateral border of the psoas major. Could you understand? Right? For example, my hands are the psoas major, for example. So it will be formed within the substance of the psoas major. Lumbar plexus will be formed in substance. But lateral border, through the lateral border, the nerves will be emerging out in this manner. Could you understand? So all these nerves are like that only. Getting it out, right? So the subcostal nerve will be emerging just below the lateral arcuate ligament. Could you remember it? Lateral arcuate ligament. Could you remember? Where is the lateral arcuate ligament? Exactly. Transverse of L1 and T12 rib, there will be lateral arcuate ligament that is in front of quadratus lumborum. So below that will be arising the subcostal nerve and vessels. Could you remember? Right? You have to see the diagram. Okay. Right. And then iliohypogastric nerve and ilioinguinal nerve will be passing all the way in front of the quadratus lumborum. Could you remember the quadratus lumborum? So, for example, if you are seeing from above downwards, this is the quadratus lumborum, for example. There will be joining point of what is this? This fascia over here. What is fascia? Thoracolumbar fascia. From that thoracolumbar fascia, what muscles will arise? What muscles will arise? What is that?
Internal oblique and transabdominal.
Internal oblique and transabdominal. Exactly. Okay. So how the nerves will be arising over here? So this is we are seeing the cross section now. Cross section. This is the quadratus lumborum. This is the transabdominis, internal oblique and external oblique. Internal oblique and transabdominis will be arising from this fascia. Okay, whenever the both layers are joining from that part, this is the aponeurotic part of the muscles over here. Okay, so the nerves will be arising deep to the thoracolumbar fascia and will be entering in between the internal transversus abdominis and internal oblique. Getting it out? The iliohypogastric nerve and ilioinguinal nerve will be passing all the way in front of the quadratus lumborum and pierces this aponeurotic part of these muscles over here and enters into the plane in between the transversus abdominis and internal oblique. What are those? Both iliohypogastric and ilioinguinal nerves over here. Getting it out? So on the way, they will be giving rise to the mid-axillary line. So it will be giving rise to lateral cutaneous nerve. Could you remember? All the spinal nerves will be giving rise to lateral cutaneous nerve. Just like that will be iliohypogastric. Sorry. Not this one. Not this one. This is iliohypogastric nerve. No. So iliohypogastric nerve, whenever it is reaching the iliac crest over here, it will be divided into which branches any idea? Iliohypogastric nerve we have seen already. It is passing in between the transabdominis and internal oblique over here. But whenever it is reaching the tubercle of the iliac crest, for example, this is the tubercle of the iliac crest, for example. Okay, this is the tubercle of the iliac crest. Just behind the tubercle of the iliac crest, it will be giving rise to a branch over here, which will be supplying the front aspect of the gluteal region. Now we are discussing about the iliohypogastric nerve over here. First of all, iliohypogastric nerve. It will be passing all the way in between the transabdominis and internal oblique over here, and it will be dividing into one branch which goes laterally over here and supplies the front aspect of the gluteal region over here. Front aspect of the gluteal region, because we have tubercle is over here, and this is the gluteal region. Front aspect of the gluteal region is supplied by this branch over here. And one more branch, it will be going in front and will be piercing the aponeurosis of the external oblique. Could you remember from the inguinal canal? Iliohypogastric nerve will be passing in between these two and will be piercing the external oblique aponeurosis and will be becoming cutaneous over here. Could you remember or not? Right? So whenever it is passing over here, it must pierce the internal oblique over here. Is it not? Whenever this branch is going outside over here, it must be piercing the internal oblique and then followed by external oblique also and supplies the gluteal region over here. So the iliohypogastric nerve will be piercing both internal oblique and external oblique. This is the muscular part, but this is the aponeurotic part over here. Could you remember or not? Right? So here also, whenever it is entering over here, it also pierces the internal oblique over here and then enters into the aponeurosis of the external oblique. Could you understand or not? Right? So whenever it is passing over here, whenever to emerge outside towards the gluteal region, it should pierce the internal oblique and external oblique also, muscular part. But here, whenever it is going over here, it must cross the internal oblique part and then only pierces the external oblique aponeurosis over here. Get it or not? Right. So this is about the iliohypogastric. This part will be supplying the skin over the gluteal region, front of the gluteal region. But this part will be supplying, it is piercing the external oblique aponeurosis over here. So that's why it will be supplying the lower part of the abdomen, medial most part of the lower part of the abdomen and partly to the genital region also. Get it or not? So whenever it is piercing the external oblique aponeurosis, it will be supplying the abdomen, is it not? So this is the entire abdomen over here, external oblique aponeurosis, just above the superficial inguinal ring. This will be piercing. We have seen in the inguinal canal, isn't it not? In the inguinal canal, it is piercing the external oblique just above the superficial inguinal ring. So superficial inguinal ring belongs to the anterior abdominal wall, is it not? Is it not? Right? So there, the lower part of the abdomen will be supplied by this iliohypogastric nerve. Understood or not? Then followed by the ilioinguinal nerve. Ilioinguinal nerve will be having the same course like the iliohypogastric nerve. Or you can consider it as ilioinguinal nerve is as branch of the iliohypogastric nerve. Try to understand this, okay? So this small common trunk will be divided into iliohypogastric and ilioinguinal nerves, but in other ways you can consider ilioinguinal nerve as branch of the iliohypogastric nerve. Get it on it? So that's why ilioinguinal nerve also will be passing in the same manner because it's a branch of the iliohypogastric nerve, but it will not give this lateral branch over here. It will not give this lateral branch over here. Get it on? Okay. And then whenever it is reaching the inguinal region over here, it is divided into what? Which pierces the internal oblique and then passes through the deep superficial inguinal ring and supplies. See here. This is the same nerve, nothing but the ilioinguinal nerve over here, which are without giving any branches over here, like the iliohypogastric nerve. And whenever it is reaching the superficial inguinal ring, because it's a partial content of the inguinal canal, isn't it? Okay. So it enters into the superficial inguinal ring and supplies the thigh, upper aspect and medial aspect of the thigh, and also the scrotum and penis over here. So this part is the thigh, for example, the upper and medial part of the thigh, and root of the scrotum and root of the penis over here. So genital region and upper part of the medial aspect of the thigh will be supplied by this ilioinguinal nerve. So what happens to this part of the iliohypogastric and ilioinguinal nerves? Whenever it is passing through these muscles, all these muscles will be supplied by these two nerves. Getting it out? Iliohypogastric nerve and ilioinguinal nerve passing in between the two muscle planes over here. Isn't it? So whenever it is passing, it will be supplying the transverse abdominis, internal oblique, and of course external oblique also by means of this iliohypogastric nerve. But ilioinguinal nerve will not be piercing the muscular part of the external oblique, but it will be supplying only the transverse abdominis and internal oblique. Aponeurosis is not a contractile part over here; it's a fibrous part. Even if it is supplied also, it doesn't matter over here, isn't it? So internal oblique and transverse abdominis are supplied by the ilioinguinal nerve over here. And later on, the skin over the scrotum, root of the scrotum, and penis and upper part of the middle aspect of the thigh. Understood or not? Getting it down, right? So the internal oblique, transverse abdominis, and external oblique are supplied by iliohypogastric nerve and ilioinguinal nerve. Could you remember or not? Right? And then followed by lateral femoral cutaneous nerve of thigh. How it will go? Lateral femoral cutaneous nerve of thigh, which is a branch from here L2 and L3. You know that very well. It will be going along with the femoral nerve. Where the femoral nerve is lodging? Where the femoral nerve is lodging? Right? So this is the iliac crest over here. This is the psoas major going downwards, and this is the iliacus going downwards. Okay. In between these two, in between the junction between these two, there runs the femoral nerve, and enters into the thigh through the femoral sheath. Sorry, outside the femoral sheath. Okay. For example, this is the femoral sheath over here. Femoral sheath is located in between what and what structure is it? What? Exactly. What is that? What is that? Exactly. It's okay. Fine. In between inguinal ligament and the pelvic part of the bone, pelvic femoral space. Could you remember? All the way from pubis towards the ilium, there is an inguinal ligament. Is it not? Pubis from the ilium. There is inguinal ligament. In between the pelvis and the inguinal ligament, there is a space, pelvic femoral space. Within that, the femoral sheath will be situated. Could you remember or not? Right. So that femoral sheath, outside the femoral sheath towards the lateral aspect, the femoral nerve enters into the thigh. Could you understand? And that divides into anterior and posterior divisions. Okay, we will be discussing during lower limb. So basically, we have seen already the iliohypogastric and ilioinguinal nerves are passing in between which muscles? In between muscles? Internal oblique and transverse abdomen. But supplies 3 muscles by means of iliohypogastric nerve, but only 2 muscles by means of ilioinguinal nerve. Okay, those things got over. Okay, what are the other nerves which will be passing in between the transverse abdomen and internal iliac, internal oblique? What are the other nerves? We have discussed already. What are the other nerves, right? Come on, make it fast, right? The lower 6 intercostal nerves, is it or not? That will be passing in between the internal oblique and transverse abdomen and supplying the rectus abdominis or not? Could you remember or not? The lower 6 intercostal nerves will be passing in between the internal oblique and transverse abdominis. That's why you can't give any incision in the midline in this manner. Not midline, paramedian. Okay. So you will be cutting all the nerves so that the rectus abdominis will be paralyzed. Could you remember or not? Right? Okay. So all those nerves will be passing. The intercostal nerves and iliohypogastric and ilioinguinal nerves will be passing in between the internal oblique and transverse abdominis. Got it? Right. But this femoral nerve and lateral femoral cutaneous nerve both will be arising from the same roots over here. So that's why they will be lying at the junction between the psoas major and iliacus. If you get the psoas major on the medialmost aspect and iliacus on the lateral aspect, this nerve is nothing but the femoral nerve, which also gives rise to the same roots will be giving rise to a nerve called the lateral femoral cutaneous nerve of thigh. Okay. This lateral femoral cutaneous nerve of thigh will be going all the way towards the notch in between the anterior iliac spine and anterior inferior iliac spine and goes over here and supplies the thigh over here. Get it out? Thigh by dividing into anterior and posterior divisions. Lateral femoral cutaneous nerve of thigh will be going in front of the iliacus and reaches the anterior spine and anterior inferior spine and divides into anterior and posterior division and supplies the thigh, lateral aspect of the thigh over here. Okay. The name itself says lateral femoral cutaneous nerve of thigh. So lateral aspect of the thigh is supplied by this nerve over here. Okay. And the femoral nerve will be entering into the lower limb and will be supplying the entire lower limb through anterior and posterior divisions over here. Okay. And then followed by obturator nerve and accessory obturator nerve. Obturator nerve and accessory obturator nerve will be lying towards the medial aspect of the psoas major over here. Okay. So this obturator nerve or accessory obturator nerve will be supplying. Accessory obturator nerve will be supplying the muscle called pectineus. We have already seen, right? Pectineus muscle. Pectineus muscle from the pectineal line. We have discussed already. Pectineus muscle. Okay. And this obturator nerve will be supplying all the adductor group of muscles of the thigh. Adductor, what are the adductor group of muscles of the thigh? Longus, magnus, brevis. And of course one more is gracilis. Okay. So all these will be supplied by this adductor, what is it? Obturator nerve. Obturator will be supplying all the adductor group of muscles and accessory obturator will be supplying the pectineus muscle. And then further will be the lumbosacral trunk. Okay. Even medial to the psoas major, the other trunk will be lumbosacral trunk. Lumbosacral trunk. So, medial to the psoas major will be getting obturator nerve and accessory obturator nerve will be occasional. It may be present or may not present. And the other nerve will be lumbosacral trunk over here. Okay, these are the things what you are supposed to see in cadavер. Understood or not everybody? Lumbosacral plexus, sorry, lumbar plexus over here. Try to study. Come, let's go to the cadaver.